Thank you, everybody, for your time today. And thank you to those accepting care who have helped pave the way for the following generations. We wouldn't be here without your hard work. And this work is personally important to me. And as we run through this, I will share a little bit of why. But the first thing that I want to open with and show you is this. So this is a patient of mine. Her glasses help her see clearly, but you can see what happens when she moves her head as she walks. If she keeps her head dead straight, she can walk, but the second there's any movement, she starts to fall over. We determined that she had a depth perception issue that had gone undetected. We addressed the depth perception issue. The glasses are very stylish. And this is actually what happened. She could walk and move her head. Now, she wasn't falling all the time, but if she lost her balance or if she kind of tripped on something, her depth perception wasn't good enough for her to recover nicely from it. And that was one of the things creating problems. Most people with depth perception issues don't even realize that they have them. So out of the audience here too, before we really dig in, do you or does someone you know experience dizziness? Show of hands. Okay, we're in the right place. What about trouble on uneven surfaces? Any balance issues? All right, we've self-selected here. What about difficulty driving at night in the rain? Now, a lot of these things, and what actually kills me with this in the clinic sometimes, is a lot of the time these things are just brushed up to old age or to just getting older. It's like, well, this is just part of getting older. I've been told this is just what's happening to me. What about difficulty with reading? Does anyone get more tired with reading, find less enjoyment from it? Headaches and migraines is another one. Then there's concussion, and I'm even going to touch briefly on a couple of attention things that may or may not impact you, but may impact some of your loved ones. But why are we here today? Well, falls are a leading cause of injury-related hospitalizations and deaths for those over the age of 65, and statistically, 32 to 42% of those 70 and older will fall each year. And that's straight from our government's website. Balance and stability matter for independence, and so does driving, because there's a little bit of an add-on here. I'm going to give you guys some tips around things that you need to advocate for your vision for driving, which can help big time. But also, reading and hobbies are good for the brain, and that involves your vision as well, and more than just clarity. So a little bit about me. Well, I was in engineering before optometry. I'd always grown up wanting to invent something that would help people. And when I was in engineering, I just felt like it wasn't really fitting. I wanted to work more with people. So I went to optometry school, and I came out of optometry school, and in the practice of optometry, it just wasn't fulfilling me quite the same way. And then a friend of mine introduced me to this area of optometry about how the eyes and brain work together. And quickly, I realized this was kind of like the engineering of optometry. Now, the aha moment for me was actually in learning that my sister had had a lifelong reading issue caused by eye tracking problems. We sorted it out when she was 25, but until then, she seriously struggled. Then all of a sudden, I felt like I had a purpose behind my work after watching a family member struggle with that. I can still remember her going back to university and saying, after we'd treated it, and saying, is this how everybody has read? They can just read it once and remember what they've read, no more skipping lines, losing my place, etc. I'm a natural skeptic of anything and everything. That's just the way that I am, and if any of you know an engineer, they probably are too. They want to know how things work or they don't believe it. And part of my personal mission is to change how eye care is done, because most of what we talk about today has impacted either my own family members or patients who are really, really close to me that I care about a lot. So our goals for today, I want to take you through a little bit of a redefining of our vision, talk about balance and falls, where it plays into driving, reading, learning to spot these things, and then kind of could your vision be involved in what you can do about it? Because a lot of the time, as you guys know, in our own healthcare system, we really often have to be able to advocate for ourselves and for what we need. So when we talk about the definition of vision, most of you are used to the eye chart at the end of the room, and we usually think of vision as seeing clearly. And the amount of times we have people talk about, my vision's not part of the problem because I can see clearly. You know, I can see things just fine. But our vision's about a lot more than that. And I'm sorry for the size of the text here. It's not just meant to be cruel to the people in the back. Vision's about how our eyes and brain work together. So yes, we need to see things clearly, but our brain is essentially calculating all of these things from our vision. When you're walking, You may see where the ground is, but your brain's needing to make calculations about how far away is the ground from you. When you're going down the stairs, how far is the next step for where you need to put your foot? All right? A lot of people, if depth perception goes really bad, they may notice they're banging cups into counters more, or, catching their hip on things or catching doorways because they can't tell where the things are. All right? This can also play into driving as well, but it's all about how the eyes and brain work together. So the old model of vision was about seeing clearly and the health of your eyes. And that's all what we're used to. Cataracts, macular degeneration, all the things we worry about for health, and then the old test if we can see clearly or not. When we look at the functional model, which is really what matters for your quality of life, this is all about how do your eyes actually work. When you're reading, how accurately do they move and work together? When you're walking, when you're doing things, how well does your vision help keep your balance and equilibrium working properly? And it's about how the eyes are coordinated. There's 4 key areas to think about. Well, there's a lot more than 4, but we're going to keep it at 4 key areas that I want you to consider, because this will help you advocate for yourself. The first is eye tracking. How accurately do our eyes actually move? And this matters whether you're trying to read a book and you want your eyes to smoothly go word to word to word instead of jumping lines and skipping the place, or whether you're scanning an intersection and you want to be able to quickly look around and understand everything that's going on without delays. Eye teaming, how do the eyes work together? This is a really important part about depth perception and equilibrium. And then there's the focusing mechanism and some other stuff about depth perception too we can chat about as well. I'm going to show you a quick example of eye tracking. And statistically, probably about 25% of you in this room will have had an issue at some point around reading, skipping lines, losing place, not really enjoying reading, or trouble remembering what you've read. What I want you to watch here is an example, and this is actually eye tracking of 2 different readers. Can you guess which reader has eye tracking problems? Okay? Yeah. That's not going to be very easy to remember what you've read. All right? And it doesn't make reading very pleasant either. Okay? So there are tools we can use to actually track and see what people's eyes do when they read. Now, ironically, the reader on the left here, who has the tracking issue, actually passed all their eye exams for the last 6 years with no issues. Because the tracking wasn't looked at, because they could see clearly. So it has to be asked for. Again, this is really small, but for those of you who can see, you can actually see a difference when we measure with a computer between 2 eyes that work together. As somebody reads, they're doing the same thing, and 2 eyes that do different things. Over on the right. That's like driving one of those like really old vans where you've got to fight on the road just to keep it going straight because the wheel alignment doesn't stay. All right? Everybody in here has probably driven a car like that at one point where you're actively working just to keep it going in one direction. It's exhausting. And that's how reading turns out. If the eyes don't work well together, one of the best ways to describe it sometimes is it can sometimes be like looking through loose binoculars. It takes people longer to focus. And this is something we actually look at during examinations because we want to know, as somebody's at an intersection or somewhere else and they're looking and scanning, are their eyes quickly able to focus on things? Or do they pull up to an intersection and they go to look around or shoulder check and there's a split half-second or second delay for their eyes to focus together before they can really tell what's happening and then look somewhere else? Because with that type of delay, a lot of people will miss the things that are going on. And you frequently hear that, I didn't see that was there. Because they looked, there was nothing there, they looked away, took a second to focus, but by the time they were ready to go again, a car had moved into that spot because it couldn't just be look, look. How the eyes work together plays a huge role with night vision and rain, and it has to do a lot with reading and learning. And just a little aside here, it's about 80% of kids who struggle with reading and learning have an eye tracking problem as part of it. Not everyone, but it's about 80%. And I've had multiple family members affected by that too. And actually, when it comes to attention and focus, problems with how the eyes work together can cause about 7 of the 9 symptoms of attention deficit because it makes it a lot harder to sit and stay focused on what people are doing because it takes way more energy to do so. But that's a little aside. This was just something I wanted to show you guys. It doesn't really pertain to you, but that's a child's writing before and after when their visual issues were treated because it was a visual motor issue, and that has to do with coordination. But that was just something we were kind of proud of. As far as concussions, it's about 90% of people still struggling with symptoms after a concussion do have problems with how their eyes track or work together. Again, often overlooked in the course of recovery. The problem is sometimes falling can cause concussions, and then those concussions can make the depth perception and balance even worse, which then makes people more likely to fall again too. Here's a great example, struggling with balance after a concussion. And then, let's see if we can see that. There we go. So struggling with balance after a concussion. And then changes depth perception. And his balance works better. Very high fashion glasses he was wearing too. They're test ones. So, yeah, so with concussion, if many of you have fallen and received a concussion, your vision can be part of what's responsible for causing everything from light sensitivity to trouble with reading, nausea, dizziness, balance problems, issues in like difficulty in busy stores or environments, sometimes feelings of overwhelm or more disorientation, and then even make night driving worse or more symptoms from driving. Now, how many of you are familiar with the term vestibular? Many? Okay, so inner ear, and that's often what we think of when we think of balance, is we think of a vestibular problem. All right, so usually when somebody's having balance problems or dizziness, we think of a vestibular problem. Now, problems with depth perception and how the eyes work together can actually also mimic vestibular problems. Okay, now I'm kind of looking for a little bit of a volunteer, but somebody where we're not going to have a fall risk necessarily. You, sir, would you be so kind? Awesome. What's your name? Ben. Ben, I'm Cam. Nice to meet you, Ben. So Ben, I'm going to change your depth perception a little here. So first, how's your balance? Good. Awesome, good. And take a step forward or two. Good, and you can go backwards. And kudos to Ben, because he basically just got voluntold. All right, stand there. Now Ben, here, slip those on for me. So first off, how do you feel? Okay. And so you can still see things, right? Yeah. Yeah. Now try your balance again. Okay, and go backwards. You're doing a good job fighting it. Can you guys notice how much harder he's working right now too to stay upright? Awesome. And now turn around in a circle. Go and stop there. How do you feel right now? Dizzy. Awesome. Thank you very much, Ben. Good man. Thanks. Everyone give Ben a hand. Now, the wild part about that was all I did was adjust his depth perception a little bit with something that's called prism. Okay, and it's a component of glasses that's sometimes there whether you asked for it or not. But I just changed his depth perception, and that was enough to cause a more difficult time with balance. Now, obviously, he can compensate in a whole bunch of other ways, and vision often becomes a bigger problem when other systems don't work quite as well, when we're not quite as strong, or if we have a vestibular problem on top of it too. And anybody who wants to come play with these after, absolutely welcome to, but just please don't if you're already having trouble with balance. It will just amplify it. And we don't have those waivers out right now. But many problems with vision can cause symptoms that appear like vestibular issues. And it's super common for people to have long-standing issues with balance and dizziness or long-standing vestibular problems. And it's where we work with a lot of vestibular physios to co-manage those cases because of what their vision's doing. Headache and migraine, we'll talk about that. But in a bit of a summary about vision, before we dive into the parts around what you can do about this and how you need to advocate, just remember that vision is a complex process that goes way beyond seeing clearly. Okay, so more than just clarity, we've got to look at how the eyes work together, how our focusing works, and how our depth perception works, and then also how the eyes and inner ear integrate. But when it comes to depth perception, your vision is part of what tells you where you are, and it's also part of what tells you where other things are. So one of the funniest things that often happens in the clinic, when I find somebody who has really poor depth perception, and there's a couple sitting there, it's kind of like, well, how are they as a passenger in the car? Because a really funny thing, most of the people who are very nervous passengers in cars often have slight depth issues. And what you end up with is you get a driver who has one perception of depth, and a passenger who has a very different perception of depth. And so it's, you are getting way too close. And the other person's like, well, no, I'm not. I got lots of space. It also starts to give you a little bit of extra empathy for the person who's taking forever to turn left on the highway, because a lot of the time they don't know how much time they have between the oncoming cars and them. So they're playing it safe to everybody's benefit. Meanwhile, the person behind them might be thinking, there's tons of time to go here. And those different perceptions of depth can completely change how people are perceiving the situation. And your vision's a key part of equilibrium. Now, as far as driving goes, we just talked about depth perception a little bit. When driving gets a lot harder, and in the summer we often don't think about it, it's light out most of the time. But if you start having trouble driving at night or in the rain, wintertime becomes very isolating here because it is dark so much of the time. And that's why it is so important to look at how the eyes work together within people's either prescriptions or setups, because you can often drastically improve the nighttime driving experience, make them a lot safer. As far as reading goes, there are things that can be done for reading to improve eye movements to make it a lot less tiring. So if people are getting fatigued with reading, enjoying it a lot less, not retaining it as much, that's an important area to have looked at as well, the eye movements when reading. And we'll kind of put a bit of a list here. Crafts and hobbies are another one. If your mobility is more limited and you can't get out and do quite the same things anymore too, still being able to engage in your crafts and hobbies is really, really key. And I can't tell you how many people have had to give up their cross stitching, give up their knitting, give up the other things that they've enjoyed doing simply because it provokes their dizziness, or they get more fatigued, or they just don't enjoy it the same way anymore. And a lot of the time it's because their eyes strain too much when they do it. So what are the causes of these things? Well, sometimes they do seem to get worse a little bit over time. Absolutely. Concussions can trigger these symptoms. Other illness can make it worse. We're seeing a lot of cases where after long COVID, it actually, people are more sensitive to whatever eye problems they have, or it seems to actually play into causing more issues with how the eyes work together too, which can add to the generalized fatigue and other things associated with that. Or having unbalanced eyes can also start to cause these things. So sometimes there's a popular setup for surgery or even contact lenses, and we'll talk about this in a bit, where we put one eye close and one eye far away. The problem with that is you actually train the brain to start ignoring the two eyes working together. And the human brain and body has evolved to have the two eyes working together. And if you take a person who has their two eyes working together, put one eye up close and one eye far away, for some, the convenience of the situation, they'll adapt to it well enough, they don't really notice the problem, but over the next couple of years, they will always have reduced gait, they will start to get more fatigue, more fog, and have a greater likelihood of falling. And I actually just did this demonstration with a dad in the office this morning because he had one eye up close and one eye far away, and he was actually in there for his son's concussion, but he was talking about his fatigue and post-COVID stuff, and we had him turn around in a circle, okay, so he spun around, and then we had him, and then I actually changed his contacts so that they were distance, had him do the same thing and then do it without. And you should have seen him, because when he does it, when one eye's close and one eye's far away and he turns around, his world still moves for a second after he turns around because his brain can't use his vision to help stabilize him. Glasses. This was not taught to me properly in optometry school. And most of you have probably had this experience at some point where you've gotten glasses and you're like, ugh, like these warp my depth and space, or these make me feel dizzy. And there's actually components about glasses prescriptions that can change depth perception, either for better or for worse, but we often don't control for that. We don't actually think of that. We just kind of make them without often thinking about, is this going to help the depth perception or hinder the depth perception? And it's a frustrating thing for people, and a lot of people don't even realize it's there. So for glasses, most glasses prescriptions are prescribed just for clearness. Okay, that's our standard way of approaching it. But if people are struggling in those areas, we want to look at that and address it. The video you saw of the woman in the beginning, it was a simple change to her glasses prescription, and 80% of her dizziness went away and she stopped falling over for stuff. My friend's mom, same thing. All we did was change her glasses, and oh my goodness, the rigmarole to get her in to see the office, because she's like, I've seen every eye person and every eye specialist and everything, and I was like, ask her what I need to bet her. But anyways, she came in, we changed it, and the other thing that he said is she no longer has a punch card at the local auto body shop, because now her judgment of where her car is relative to other things is actually much more accurate. Um, so glasses can either be part of the problem or part of the solution when it comes to depth perception. Um, Cataract surgery. This one's really important. Many people in the room have probably already had their cataract surgery. Some people may have it coming up. With cataract surgery, that's replacing the natural lens inside the eye. It's an amazing thing. There can be some shortfalls though. The human brain is made to use our two eyes together at the same distance. That's how our body is made, and that's how it's been for a very long time. The convenience factor of putting one eye up close and one eye far away actually starts to cause a lot of problems for things. So if somebody has one eye close and one eye far away, and they're experiencing depth perception, balance problems, etc., which most will end up experiencing, it is one of the things that needs to be addressed. It doesn't mean the surgery has to be done again. There's other options, but it is very important. So we want to be very careful of that. And my recommendation to all of my patients is to always get both of their eyes done for distance, because the one eye close, one eye far will make night driving worse, driving in the rain worse, it'll cause more fatigue, it'll make reading more tiring, and it will make balance and depth perception worse. Now, mind you, I still use that with people sometimes in contact lenses, but it's usually for stage actors, because for that short period of time, they need to see close and they need to see far, and they can't wear glasses for their role. But as far as day-to-day life, it can be problematic. Sometimes multifocal lenses can be problematic too. Sometimes they can be amazing. But cataract surgery for multifocal lenses, if somebody is already dizzy or sensitive to dizziness, it's not a great thing to do because it disrupts the visual system even further. Now, mind you, there's a lot of people who love their multifocal lenses too. So really the advice there usually is if you're sensitive to it, you don't want to do it. But there are things that can be done to help after. But the best option, if you're concerned about balance, night driving, and all of those things, is to have both eyes done at distance. Because then the two eyes are made to work together the way that our brain has used the eyes together for our visual system for thousands and thousands of years. Um, yeah. But yeah, if it's been done differently, it's not too late to help. Now, what can you do? Well, if you're concerned about these things, you want to make sure that you get specific testing that actually looks at how your eyes work together and how that impacts your depth perception and your balance. Okay? For how many of you, when you got your glasses, did anybody look at how dizzy it makes you when you move your head in the glasses? It's not part of our standard testing, but it is something that affects people. Okay? When these things come up, so you want to look at how the eyes work together, how it impacts depth perception, and how it impacts how the eyes and the inner ear work together too. So that involves finding an optometrist who's experienced in those areas, and usually what you end up finding if you're Googling things is somebody experienced in treating binocular vision dysfunction, and they may have experience in vision therapy as well. And vision therapy, unlike what it sounds like, it's not about exercising eyes, it's about retraining how those things work. But a lot of people who don't do vision therapy can know how to prescribe glasses in ways that help with depth perception and identify those problems as well. But it does require specific testing. So you want to ask about how the eyes work together, ask about how that impacts depth perception and balance, and especially how your glasses prescription impacts those things too, because that is key. A lot of people will be wearing their glasses because they can see better and they help, but they might actually be hindering in some unknown ways too. Treating these things can sometimes involve something as simple as a different prescription. Other times there's actually sort of therapy treatment that can be done too to retrain how things work. But if I can leave you with a couple of things from today, please remember, vision's about a lot more than clarity. And if you struggle with any of these things, please advocate for yourself to get these tested. Because a lot of the time otherwise, if it's just looking at clarity and eye health, these issues may not be picked up. But I did want to be able to open things up for questions to people as well, if there's anything that we can be helpful with. I see, we'll start in the red stripe. Yep.
You mentioned something on the screen about progressive lenses being problematic, but I didn't have a chance to finish reading the sentence before you moved on. You moved quite through.
Good question. That was probably the coffee that I had earlier. The progressive lenses don't always have to be problematic, but sometimes they can be. One of the reasons why is the way that progressive lenses are typically made or designed can sometimes have space like effects that make depth perception weird. But there are ways to make and create progressive lenses that don't make depth perception weird. So they don't always have to be problematic, but sometimes they can be. And that's why a lot of people sometimes do struggle with them. But usually most of the challenges that people have with progressive lenses come because the spatial effects of the progressive lens were never accounted for when it was made or prescribed. And so that's often why they can be a challenge. So if they're not done intentionally, then often they can be making depth perception more difficult. Uh, you'll I ask the people who made it. That would be the best way. Because what's really hard is as a patient, as a person advocating for yourself, how do you know if things have actually been done in the best way possible for that? They may have, and they may not have. And I'd say the best thing you can do is ask your provider if those things were tested and if those things were accounted for when it was made. That's usually one of the best ways to go about it. Sorry, I had one right here, and then I'll come over because I didn't want to miss you.
Just wanted to know, when they put in prisms in your glasses, what does that do?
It can do several different things. So prism, the question is about prism in glasses. What prism can often be used for in glasses is to correct for eye misalignments. If an eye sits higher or lower, that's one of the things it can be used for. However, prism can also be used to change depth and spatial perception too. So what I put on Ben that made his balance worse and the world look weird was actually a whole bunch of prism. So prism's a tool that can be used in a bunch of different ways. And I think one of the challenges is that the traditional way of prism is only about eye alignment, and it's often not harnessed to help with depth perception the way that it could be. And sometimes when it's given, like the way I was classically taught, if in my past I gave people prism for eye alignment issues that actually made their depth perception worse, and I didn't even know that I was doing it. Because I was giving it to help one thing, but actually worsening another thing unknowingly, just because I didn't realize that relationship existed. Yes.
You mentioned headaches and migraines in a couple of slides, and you said you were going to talk about it later.
Yeah. Yeah. I was trying to be conscientious of time because I realized I had more information that I wanted to share with you guys. Vision is a major cause of headache and migraine, and there's a really easy way to tell. The easiest way to tell if somebody's vision is caused by headache or migraine, or sorry, if vision is causing the headache or migraine, there's little black and white lines that you can show somebody, and it's really easy to tell. But also sometimes when you ask people, you're like, does your headache get worse after reading or computer screen times? Does it get worse with light or flashing lights or flickering or things like that? But it is also an overlooked cause of headache and migraine. My sister struggled with that for years, and it went completely unaddressed. And it went unaddressed because the part of her vision causing the headache and migraine was her two eyes not working well together, and they were constantly fighting all day long. Yeah, you could actually, if you prescribe someone glasses and made their eyes fight, you could give them a headache quite quickly. Yes?
What about double vision?
Yeah, good question. So yeah, double vision can mess with a lot of things because that disrupts your depth perception big time. I'd say most cases of double vision can usually be resolved. There's some rare ones that can't, but most cases of double vision, the majority, you can usually get the two eyes working well together. I'd say the exception to the rule would sometimes be if there's been such physical damage to one eye that the two images are so different that they won't overlap with each other. But a lot of the time, a lot of double vision stuff, you can get the two eyes coming together. Not always, but it will make depth and balance harder because your brain doesn't know which is the real one. So yeah, it's not fun to have.
And you know, my optometrist or ophthalmologist said my two eyes are misaligned. Can they align it together? Because I never can have two eyes working together. That's the hard part because I feel kind of wonky all the time.
And with the doubling, you will feel wonky for sure. It's hard to say without knowing everything about it by any means, but there are different approaches or different styles to getting the two working together. So usually what I'd say is if you've tried one person's approach to it and you haven't found success, I wouldn't necessarily give up on that yet. Usually, check in with somebody else and see if they might have a solution for you too, because there are a few different sort of schools of thought in how to treat the double vision. And I know for myself, the way that I was trained originally in school is quite different from how we've wound up practicing over the years with what we figured out too. So yeah, I'd encourage you not to give up. But at least, you know, you want to find C for that. And it doesn't mean it'll happen for certain, but might be helpful. I saw another hand over. Sorry, red, and then we'll go back. Yes.
How do you find an optometrist with this kind of specialty, whatever?
I often say Google for that. That's usually the one. That'd be the easiest way to find it. I think there's a couple of people in Victoria practicing who work within this area. Yeah, that'd be the easiest way to find it too. I'm very not self-promotional for things, and that's not the way that it works for stuff like this. Really, the core of this is education. Yeah, you'll be able to find it through Google. Like, we're one office that treats these areas of things. There's another number of other optometry clinics that are starting to get into these things too, but it's definitely not every office. Yes.
So far, you've managed to worry me tremendously, because I think there could be everybody in this room wondering what they're seeing, if their eyes are okay.
It's actually a really good question, because it's hard, because you don't really know until you know. It's like that, and that's often the amazing part. I had a woman the other day where she never really experienced depth perception properly, but she'd never had it before. And she actually stood there just crying, looking out at the trees, because she said, I can see which branches are ahead and behind which. And before that, even with her glasses prescription for clarity, she said the trees all looked like they were at one depth. And she actually just stood there just bawling. So you're absolutely right. The hard part is how do you know? Now, I'm a pretty pragmatic person, and part of my background's Scottish, so I'm pretty cheap too. So usually, you know, the old saying is, you know, it's only a problem if it's a problem. So I'd say that, you know, it kind of falls into several things for people. Either A, you'll get the people who are just curious and they want to know if things can be better. And then you'll get the people where it's like, if it's a big enough problem in their life, then they'll go seeking solutions too. But to be honest, part of my life mission is to change eye care so that when prescriptions are given in general to anybody, these things are accounted for. Because there is no reason that people should be having to go seek special care for that. That should actually just be part of how we're taught how to prescribe lenses and understand those things in school. Because at the end of the day, it's actually all just physics and known neurology. It's no crazy secret.
Follow up, could you please give me a list of opticians or whatever that I could go to and trust?
Yes. Yeah, I'd be happy to after. For sure. Yes.
What about peripheral vision? Because I feel that with glasses, the peripheral vision that I relied on, especially for driving, is just like...
That's actually a really good question, because a lot of people will feel like the glasses restrict their peripheral vision. Now, the crazy part is that your peripheral vision doesn't depend on clarity at all. But your peripheral vision is hugely involved in your balance and your depth perception and knowing where things are and what's going on. And if you give people prescriptions sometimes that make their eyes strain more. So everybody in here heard of tunnel vision? Okay? So it's like, if you watch a kid play sports and they're having to concentrate too hard, they'll kind of get tunnel vision and they'll lose the other things around them. Sometimes, in my practice, what I've found is that if somebody has a prescription that may be causing them to have to strain or focus too hard, it's like they lose their peripheral vision because they're having to just work so hard to see centrally. Because the two systems are actually a little bit different. And so that's often one cause of that. Now,
My head doesn't turn like it used to, you know, so
Yep.
I feel like I'm relying
especially, yeah, driving and other things, you'd be relying on it.
on getting reflections.
Now, that can also come down to certain frame things and certain lens things. But I'd say for sure, there's more than likely something that may be causing you to strain to focus a little bit more centrally, which then means your brain ignores your peripheral vision a little bit more. And we've all had that before. We've all been super focused on something, and it's almost like we didn't tell what was going on around us at that point in time. But that is a really, really good question, because your peripheral vision is incredibly important.
I'm quite concerned with what you've said earlier about
I didn't mean to concern you guys. That wasn't the goal for today.
really freaked me out. I wish I talked to you 7 years ago. I had laser surgery done, and I had paid a lot of money for it privately, so I could have one distant vision, one reading. lens. And now I'm hearing you say that we're really going to have trouble down the road.
Well, and in theory, yes. Now, one of my good friends did basically the same thing. Oh, the question was about having had surgery that put one eye at distance and one eye up close. and really being quite concerned about that. Now, I don't necessarily mean to be the one to strike fear, because that's not the thing either, but really to make you guys aware of that. But one of my good friends has actually had the same surgery, and for much of his life, it's convenient. But one of the things that we ended up doing with him is he actually has a prescription that lives in his car that he uses when he drives at night, because his night driving is way better and his focusing is way better.
And I do too. I have prescription for reading, prescription for distance.
Yeah, and then so the one for distance should actually be able to be done in a way that helps make your balance better and your depth perception better. Yeah, and so it's, I'd always say it's sort of the combination of it's only a problem if it's a problem. But if you're curious about it, there are ways to test it and to see if it's impacting you for that. And then at least now if it comes up for you, you've got a way to solve it if it does become an issue. But what the study did show was that basically when the two eyes are different, the brain starts to break down the processes of using them together. And then over time, what they showed was in seniors, there was actually a reduction in gait. People stopped walking as confidently through things. We see it with people all the time on stairs, especially. We're just, 5 minutes? Okay. Sorry, I have to do orange in the back first, and then I'd be happy to chat after. Yes, sir.
I have two questions. One about dryness of the eyes, and also what causes floaters and how can they be corrected?
Those two questions, they're good questions. They're a tiny bit out of the purview of my area for today. The floaters, I can tell you, are usually just caused by the material in the back of your eye just kind of aging and degrading. And unfortunately, there's not much to be done about floaters unless they get really bad. That's a sort of bane of everyone's existence. And then dryness, that could be a whole other lecture. So for the sake of sticking on topic, if you're okay, I'll kind of stay on topic for that one. Yes, sir, in the vest.
Yes. Throughout your talk, you've mentioned the brain and its function in this whole thing. And we'll be going to the next lecture on dementia. Nobody has raised that. And if you could make some comments about switching of the brain and maybe.
Yeah. So it's a really good question. And just regarding dementia and some of these things. So what we see is that when people are aging and their depth perception or vision things get worse, we can almost always bring it back and make it way, way, way better, except in cases of quickly progressing dementia or other neurological conditions where the brain's kind of losing the ability to learn and hold on to information quite a lot. And it's actually sometimes in my world, one of the contraindications to certain treatment, because you might be able to change their glasses and my friend's dad with dementia now trips less, but we couldn't actually do anything really active therapy wise to help him because he wasn't going to retain any of that. And that was something we learned quite a while back. They can kind of go together because it starts to shut down a lot of the systems. Yes, sir.
Yes, I have a severe balance problem, really severe. And standing up in the daylight, just standing, I still have difficulty holding my balance. But at night, I daren't get up and stand up. I'm in one position. But before the problem occurred, I could do that. At least I could make a step forward when it was dark.
Yeah.
I can't do that anymore.
That must be so frustrating. There's probably two systems at play, two main ones. The inner ear, and so this is where we work with a lot of physios who do inner ear stuff too, is the two systems you want to get thoroughly assessed and checked out would be the inner ear and then the balance part of it, like the vision part of it too. And between those two systems, that's likely where you're going to find the main culprit there, because it's going to be one of those two. And there are some amazing vestibular physiotherapists around. There's some out here on the peninsula, there's some in town. But between those two things, that's what you want to find is the people who really address both of the systems together. Because even if one system doesn't work well, sometimes you need to teach the other system how to compensate for that. Wonderful. Great, I guess as a little thank you for today for everyone too. My colleague in the office, who is amazing, he does exactly what I do. I just joke with people, he's a lot more calm. But he actually set up a thing. So we've got a little list. If anybody is interested, one of the things that our office decided to do as a bit of a thank you for people is there is a credit towards an examination if anyone does want one, and there is a credit towards optical if anyone does want one. I think it's $100 on each thing. So he decided to donate that to everybody too. So he's awesome. Well, it was me and him together. But I'll pop up a little list outside too, and if anyone wants that, you can just pop your name on there, and then they can give you a buzz. Absolutely no pressure to. Like I said, you can absolutely Google and find people who can address these things as well. But we thought we'd kind of give something nice to the group as a thank you for taking the time to listen and learn.